Well, it's my pleasure to host Dr. Larry Burks today. We've been collaborating for many years since he moved here to Oregon on treating mutual TMJ and headache patients. And I've been so happy with the results, and I wanted to introduce what Dr. Burks as an upper cervical chiropractor does for patients and how important it is to, especially for TMJ and headache patients, to look into such treatment and to understand the value of having good alignment in the neck, especially the C1, C2 alignment. Welcome, Dr. Burks. It's
Thank
nice
you.
to have you here. Um, so a little bit of a background about Dr. Burks. What I was really fascinated with his treatment philosophy is that he really likes to use the own body's natural ability to heal and stay healthy, which yields really long-term results and not just treating the symptoms, which is temporarily. Dr. Burks received his bachelor degree in exercise and sports science from Oregon State, and he continued on with his doctorate of chiropractic in Life Chiropractic College in California. And then he specialized in upper cervical through two different specialty programs, one in California and one in Georgia, to specialize mainly on the upper cervical alignment. Dr. Burks, please tell us why upper cervical and how is it different than a regular chiropractic?
Yes, great question. So most people understand chiropractic as maybe a full spine treatment or type of lifestyle, something that they do for aches and pains, maybe car accidents, things like that, sports injuries.
Mm-hmm.
Upper cervical chiropractic is kind of a subset from that, where it's only about 5% of chiropractors in the nation practice this way. And we do it because of its kind of need in the profession, because not everyone's doing it, but also it's a way to be more maybe efficient with corrections to the spine. So that means less adjustments and longer times in good alignment, and maybe helping cases that are very difficult, more than just your whiplash kind of situation, things that are more neurologically involved or chronic over multiple years. So upper cervical, just the anatomy of it is way different than the rest of the spine. I don't know if you can see my model here. So the top two bones don't have facet joints. So these interlocking joints in the spine make C3 all the way down to the sacrum very stable. So when you get up to the upper cervical spine, you just have your atlas, your C1, that's just a ring of bone that sits right under the skull. And so it's held in place by soft tissue, which makes it very mobile, but not stable. So people can get out of alignment in the top of their neck way easier than anywhere else in their spine. And just neurologically, you have a lot more going on in that area too. So it takes someone who wants to dedicate their whole practice to the focus of this area to be very efficient and get the results that you would hope for when you get upper cervical care. General chiropractic, you can adjust everything, even the occiput all the way down. But when you have an upper cervical doctor, you're getting a very focused type of care that is just kind of exponentially better because it only is right here day in, day out with all the patients. So it's based off of more neurology and measuring how the function of the nervous system is doing with objective measures. So one thing you wanted me to mention was thermography. Right here, this is a digital thermography unit. So with this, what we're measuring is one function of the brainstem, that's blood flow control. So your brainstem at the very base of your skull and up into the skull has many different life-supporting functions. So when you go to sleep at night, your brainstem keeps you breathing, right? And we can get into that later with the central sleep apnea and those causes with TMJ. And other things it controls is blood flow, regulation throughout the body. So if you go outside right now, it's going to be cold, and your blood vessels at your extremities clamp down to bring all the heat closer to your core. So your brainstem's doing that without you thinking about that. So that's how this can measure how that brainstem is doing, is because it's using that heat and the imbalance of that blood flow. And what we do on an exam, we want to see a baseline. So what we do is we scan right up the back of a patient's neck, and it's measuring about 100 measurements per side, per inch, I guess it would say, or about centimeter. And it's comparing how that body is balanced, blood flow wise and neurologically, with how the brainstem is doing. So we get a baseline, and we use the objective data. We also feel the neck and look at posture. And one thing that you'll probably point on is you'll see your patients standing like this, or the head tilt, and kind of, postural references to misalignment where they're walking around with the head not on straight, and how that can start to affect their bite and their jaw and everything else. Yeah. Or they're compensating from that bite, and they have to tilt their head to do something. So upper cervical care it is combining objective data using scanning or postural imbalances, things like that, to look and see how is that alignment at the very top, and then we use digital x-rays to see how to correct it. So on our exam, we use a side view, a frontal, and then a base posterior. So we kind of getting XYZ coordinates of everyone in their exam. So an exam is your 4 thermography scans, the rest of the postural analysis, range of motion, and then at the end of that, if that's all saying yes, there is a misalignment, we do digital x-rays. And so that shows us where the misalignment can be. We do them, one, for safety, to make sure when we do a correction, we're not going in there blind. And then 2 is to see exactly where that patient's misalignment is, because everyone's going to be shaped different. Their angles of their joints are different. The spacing in between the skull and C1 and C2. So that gets us laser focused on how to get this one bone back in alignment. And the biggest reason to do that is right here, you have a huge hole in the skull where your brainstem comes down, and you can twist your C1 from an accident or injury in the past and put pressure on the brainstem. And of course, that affects your whole body to brain connection. And left alone for many years, patients start manifesting symptoms out of the blue, almost.
Anywhere from breathing to digestion to thinking, it can affect everything when you're talking about the brainstem.
Brain fog. The most common we see here is middle-aged females get migraines, and they've never had them before. And they're like, why am I getting this? It's because I'm getting old, I have to talk them back away from that, idea. But no, it's many years of a little bit of brain function that hasn't been 100% add up over time. So then you kind of walk off the symptom ledge and you've got a problem. So
that shows you how sensitive that area is, that you're adjusting by just demonstrating the anatomy for our patients. And I think you mentioned a key word here, data. You said you will do tomography at the beginning, and x-rays from different angles to see the shape of the bone. And then the second thing is that every time a patient sees you, you do the tomography, which kind of gives you a sense of where that brainstem is sitting or where the malalignment is. And if that tomography is normal, you won't do an adjustment.
Correct.
That you do that. And I think the reason neuromuscular dentists love upper cervical chiropractors so much is because we're all about data also. We do, as you know, with my patients, before we do any TMJ treatment, we have CT scans to show us the shape of the bone and the position the disc is in at. And also it gives us a chance to evaluate sinuses, and deviation in the septum, because good breathing and TMJ disorders go hand in hand. Another thing that we do is that we do EMGs. We look at the muscle activity. We do sonography of the joint. We do computerized jaw tracking to
I
look
love the picture when you like take a photo from the side of a patient with all the electrodes on their face, and then the K7, like the whole frame. It's like if someone's getting data, you are getting data.
It's just giving me data,
Yeah.
and this
Yeah.
data is the most valuable commodity.
Right.
When you have data, then you can make an educated decision.
And it's objective data too.
Yeah.
So like if someone was doing the same test you were, that is interchangeable. It's not like, well, I think that this doctor saw this and then you saw this, and so yeah.
And the reason it's so valuable is because we know that the axis of rotation for the mandible is actually from C2 that you just showed people. So if C2 is canted slightly, or if the occlusion is canted slightly, it can affect that.
Right. Right. Yeah. That
Please
rotation.
elaborate more on that.
Yeah. Perfect. So that's what if you refer a patient in and you want them evaluated, and then we either do a few treatments or one, and then send them back to you once they've got some sort of balance in their upper cervical spine, and then fitting them for a Myoaligner because they've got a good baseline with that is helpful. But also vice versa, if I'm working with a patient and I'm multiple adjustments, maybe a month or two, and they can't hold their alignment past a week or something like that, something else has got to be inhibiting that.
Yes.
And so
which is unfortunately a lot of times it's a pathological occlusion. Is that what?
Yeah. So we get into that. I was like, well, how are you sleeping? Oh, you're not sleeping very well. And then when you are biting down, does your back teeth even touch, or is it just one side? And then light bulbs start going off of, okay, this is a multifactorial issue. Yes, I found my portion of the pie that I need to help fix, but a person isn't just pieces randomly out there. They're one, solid interacting unit of multiple systems. And you can't, separate it too much sometimes. So when someone's not holding and we have those things going on with their bite, it's not right, they're not sleeping well, sending them to you to have their occlusion evaluated and airway. Once they get some sort of treatment from you, there's different levels and things that you would explain, but there are upper cervical holding ability for alignment is like exponential. Because they're not having to adapt to some weird bites and hold their head a certain way to feel their jaw not be painful, something like that. So it helps me look good when I send them to you, because you address the other portions of their health pie, that when it's all kind of evaluated, exponential, results. So
that brings me to a point. It's so important to have a multidisciplinary approach when it comes to treating a TMJ and TMD patient.
And do you remember how I found you?
No.
Not to interrupt. It was a naturopath that said she heard you talking, at a seminar about TMJ and airway restriction and what you got, as you as practitioners, naturopaths could look for. And I thought that was pretty cool. I was like, what, a dentist talking to a naturopath, and why not, and so that was cool. I already knew you were kind of holistic and open-minded to not just, straightforward dentistry and crowns and things like that. And then come to find out there's a name for your style of dentistry and evaluation.
Physiologic dentistry.
You're right. Yeah.
Yes, we always, the main factor that we look at is airway, making sure that our patients can breathe through their nose, which is super important during this pandemic because the nose is the best filtration, HEPA filter system that you can find out there.
Right.
And also the value of nitric oxide gas, which is only released in our paranasal sinuses, which is number one industrial disinfectant, actually, the NO gas.
Oh, yeah.
Known as the gas of the century because of its therapeutic values, So our patients that are mouth breathing, they're losing the filtration system of the nose, and
Right.
they're losing the nitric oxide gas, vasodilating effect of the nitric oxide gas.
And I feel more tired when I have to wear a mask because I'm not breathing through my nose as much.
Yeah.
And my blood vessels are, you know, I don't have that dilation.
So now more than ever, it's so important during this
Right.
pandemic to be able to exercise good breathing, to
Right.
give your body that oxygen that it needs for survival. So that is one of the key factors that we look at when we have a TMD patient. Then, you know, if you're not breathing correctly, that means your tongue posture is not correct in your mouth. Your swallowing posture is not right. That means most of the time the occlusion is not right. And occlusion is a chronic problem, low-grade chronic problem that constantly breaks down the joints, and we know that it directly affects C2 alignment, C1, C2 alignment. So you might have an accident patient or a whiplash, somebody that fell off the ladder. It could be just one-time incident. Those are easy to fix. But if it's a chronic problem from years and years of pathological occlusion and not the ability to breathe correctly and swallow correctly, which we see so much, especially in modern societies, unfortunately, because of the modern diet. Our kids are not used to chewing their food. They're just used to these crackers that just swallow, you know, and dissolve in their mouth. So we're not using our facial muscles, our masticatory muscles correctly. And obviously it just puts a lot of stress on the muscles and the bones, you know, and we can, that's why.
Yeah. If you're not using it, you're losing it.
Yeah, exactly. So
I remember you said one time you had asked a younger patient, when's the last time you actually chewed some food and what was it? And they said like chips. I was like, oh man, you know, what about like jerky, or, you know, what about an apple? You actually open your mouth to bite it.
No,
that was, and then I thought about that. That's how kids are growing up, you know.
And look at burgers, you know, or you know, chicken strips, things like that. Everything is already processed and kind of like queued up for you. And you know, so if you're not using the muscles right, then
And then the diet itself, maybe making more of a histamine reaction and allergies, and including more to make them have to open their mouth to breathe instead of, you know, having good passage. Like people may be having too much dairy in their diet, like you were telling me this, and creating that almost like mucus production or problems with the nasal cavities, where kids are like, well, this is more efficient.
Yeah, just a little bit of a mouth, just slightly mouth open posture. You kind of like see that in the beginning, you know. You can see that kind of a long face with mouth, their dark silk curls under their eyes. It's not an attractive face because it's a long face, you know, long face. And you can see that in kids, you know, and then, you know, those are the kids that are going to struggle at school. Those are the kids that are going to be low on oxygen in the morning. They're going to be grumpy in the morning. They can't pay attention. And unfortunately, what is our society doing? Most of the times these kids end up on ADD, ADHD medication, while we have the source of the problem completely ignored.
Right. Yeah. Yeah. Well, it's not even the parents' fault that they might go that direction. They just don't know.
No.
You know, and where do you go when you want help with your child's health? You go to a pediatrician, you go to the doctor. Mm-hmm. Most of the time that's just a medical doctor, and they have a certain skill set and how to help. And that's kind of just the mainstream, which is good to have these conversations. Other people can hear what we're saying to maybe think something a little different, or at least get that talk started, that idea.
And that's why we were doing this for our general public, you know, so we can bring more awareness about more holistic approaches, multidisciplinary approaches to care, where you can not just address the symptoms, but address the cause and set a good foundation for these kids to grow up and become healthy adults that can sleep well, and their body can repair during their sleep, you know, and they can chew and function and enjoy a healthy diet, healthy fruits and vegetables and nuts, you know, that doesn't cause inflammation in our body.
Right.
So it's again, back to that multidisciplinary approach. It's just so important to make sure patients who are looking for a solution to consider that.
Yeah.
Nobody can just fix your TMJ. You know, with more than 20 years of experience, if I have a patient in my practice, I swear that I cannot just fix their TMJ and get rid of their symptoms. You know, there is other things involved. The body adapts, and that's why they need to see chiropractors. They need to consider that. They need to consider improving their diet. They need to look into a sleep apnea test. Maybe we have so many home test options available. It's so inexpensive.
Yeah, that's what one of your patients came in on Monday or last week. Yeah. And they said they just had a sleep study done with you, and I was like, oh wow, I heard you were thinking about it or getting into, but that is even one more thing you can offer as a dentist that no one even knows.
Yes, we work with physicians, so we always have sleep physicians collaborating with us. You know, but we can make it easier. Even after this whole COVID crisis, there is companies that are coming up, and we use that in our office with disposable home sleep tests. So, you know, through an app you can just download, and that app is connected to our sleep physician. So they just put their pin in the app. We give them an oxometer, a heart monitor,
and they can sleep in their own bed.
In their own bed. They don't
the variables low.
Yeah. It's very inexpensive, you know, and it's very accurate. It also gives us the upper airway resistance syndrome. Just the sleep apnea. So it's been such a valuable information to have part of our diagnosis. And and the more data you have, it improves the prognosis. Because your knowledge is just power. Yes.
So with you working with you, I've kind of found different types of patients. I don't see a ton of kids in Dr. Cantwell. You might have her on the channel, or you've had a video with her. She's more into pediatric care for chiropractic, and but you kind of see both ends of the spectrum, kids that might end up like these adults that we're trying to help with. And I've heard your passion on helping the kids early, especially because that's going to be who's going through society and going to be in positions to help us as we get older. You know, they're going to be the doctors and the teachers and the lawyers and government.
They're just going to succeed. They're going to be more successful in life when they're healthy and they have energy. You know.
So I'm happy that you're taking on the kids before the problems can happen.
Thank you.
So make them.
With Dr. Tennant, she joined me as a partner. Dr. Tennant, you know, so her specialty has been sleep and adults, you know, with oral appliances. But now we have that testimonial on our website. I think she had a 7 or 8 year old that was a bedwetter. And you know how embarrassing that can be for a little boy, you know, that wants to have sleepovers, and it's just such an embarrassing thing to have. And even though the mom was a nurse, nobody had looked into sleep apnea for this child. So after they did the test and this child was positive, with just maybe a few months of appliance therapy to widen his jaw and help him put the tongue in the right position and the tongue stopped choking him at night. You know, and this guy stopped not only bedwetting, but he is now communicating with us better. His communication skill improved. He used to be a picky eater, you know, couldn't like have chicken and lasagna together. It was just so picky. But he's now eating well. So you can just see how she impacted this child's life long term.
That's amazing. That's cool. And how much better he's going to be, you know, in the future because someone did something early.
Yes.
And it's kind of it's nice to practice as much proactive care as you can, but some of us are like, we don't want to get any help till it's absolutely necessary. And then it's a little frustrating sometimes to kind of like, well, if you would have caught this, you know, 10, 20 years ago, would have been helpful. But with all the amazing technology and Myoaligner now that you guys have developed, that's taking even more time off of what it would have took, you know, in the past to help people expand the palate, get that tongue up to the roof.
Yeah.
And I've seen my patients, like their smiles look even better when they come in because it's just fuller. Their cheeks are where they should be, not this kind of hollowed down,
Yes.
drawn out look. And like, wow, you're actually, your facial structure is changing on the outside, which is kind of cool. And they're happy.
Yes.
And they're getting sleep.
Yes.
So,
Yes. Sleep is the most important thing. Most important.
Right.
Could you cover a little bit of on your technique, and
Sure.
And how you adjust? Maybe if you can show us on that skull too. And
Yes. So when we do an exam with a patient, first we want to know, do they actually have a misalignment, or is this something else that should be addressed a different way? So I'd say maybe 1 out of every 20 exams we do, the thermography, the scanner, the objective data shows that they have good function, and immediately right then we don't need to finish the exam. It's just they don't have a misalignment. So I don't help
there's good blood flow on both ends of your stem cell.
Yeah, brain cell. Yeah, brain stem. Right. So we don't take yes, yeah. So we don't take on everyone that comes in the office because it's not always their issue, but most of the time. So with the upper cervical spine being a whole different shapes kind of bone, you need a very specific correction to that area. You can't just put a force in there and hope that it realigns itself. You can move it by doing different types of therapies and things like that. But when you want to make sure you give a patient a true correction to get pressure off the brainstem, you need to have some sort of objective measure after an adjustment also. So a typical visit is a patient will come in, we'll scan them, knowing what their thermography looked like on the exam. We have a baseline to know what they look like when they're in alignment and when they're not, when we should leave it alone and when we need to correct it. So at every visit we use thermography, we scan them, and then if they need their adjustment, we use a knee chest table. I'll turn you around. I don't know if you'll be able to see that table over there. Not your typical chiropractic looking table. Yeah. So it's a kneeling table, and that one gets a patient into position where they can turn their head and lay it down on a solid surface, so that when we give an adjustment, that it goes right there to the C1 and not just kind of diffuse through the whole neck there. So it's a very kind of pinpointed corrective adjustment. And I wish
you can correct the pitch yaw roll of that C2 with that.
Yeah. So C1 and C2. So when we adjust one or the other, we're looking at how it'll affect the one we're not touching, so that you get a positive benefit for both. And the most common is they're both out of alignment usually, because they're connected at the base of it. So so when we're looking at a misalignment, you can have so many degrees of misalignment because everyone's bone structure is a little bit different. The angles are different. So when we adjust it there, we adjust it based off the x-rays because that shows us the bony structure. We know when to adjust it based off the thermography because that shows us when it actually needs a correction. And then after an adjustment, we take them into our relaxation room with the 0 gravity chairs. So what you want to do is
I love that I never wanted to.
Right? Yeah. So it's kind of like you enter a spa and you just hang out there. I swear, we have low light, we have chairs that recline and almost kind of float you in place. And the goal is to not give the nervous system any more stimulation than necessary while you're getting your upper cervical adjustment integrated. So it's called the reintegration room, actually. Because when you adjust that upper cervical, it's almost like hitting the reset button on your computer.
Yes.
When you do that and it loads back up, you don't want all these programs popping back up and overwhelming your system. You want it to kind of load up slowly.
That was a great analogy. Thank you for using that analogy.
Right? Yeah, you don't want it just freezing up or just, you know, so what does that look like in real life? Well, if we were to adjust you and then send you home, you're having to go into traffic and hold a certain posture and you look around and stuff like immediately. You don't want that. You want to hold still and relax and chill. So patients are in there for 15 to 20 minutes after every adjustment. And then they come back out and we'll scan them again and make sure that when they leave that their nervous system is working better, if not completely cleared out, so that we know it didn't just feel good. It actually, function-wise, you are leaving healthier, so that helps make longer times between visits, and spread out your care, because that is ultimately, the patient's healing themselves. So I don't need to keep seeing them so many times. We want to make sure it's in place and that it's there long enough that they can get that pattern. But the body is a self-healing organism, and we're just there as not a, what you'd call a sage on the stage, but a guide by their side as they're going through life. We're not up there telling them what to do and how to heal. You're part of their process. And if they get off the path, then we're at our specialties to kind of figure out where that is and get them back to optimal health. That's the whole goal. So, and that's how
we're really grateful for practitioners like you, who go beyond, their original training after graduation. And as you said, only 5% of chiropractors in the nation practice what you do. Similar to neuromuscular dentists, the 5% of dentists are neuromuscular dentists, where they pay attention to the craniosacral alignment and the posture and the airway and the pathological occlusion. And I mean, it's nice to have practitioners like you that are, we know patients know that there's hopes for them.
Yeah, I appreciate
hard
that.
To find, hard to find, because 5% is not a big number. And
well, when we don't have a pandemic and people are traveling, it's a little bit frustrating that I'm trying to help them find, other upper cervical doctors, because there's not just like you would go, go to the grocery store. You can't just go wherever. You have to kind of live around, unfortunately. But everyone's holding still now, so it's a little easier. But yeah, I would say referring for patients that don't hold their adjustment because that malocclusion is like a game saver sometimes, where we get to a certain point and maybe their migraines are less frequent or less intense, but every time they go to eat, that occlusion's off, and then it's a trigger for a migraine. Well, I can't help that to a certain degree. So when they can hold their alignment longer and that's fixed, then they're like a superstar patient, where we get the testimonials from, which is great. But I'm glad I found you from that naturopath, because it's been fun working with you. Yeah.
It's been what, 7-8 years probably, right?
8 years, yeah. Going on 9.
I joined the Portland TMJ study club that I was hosting.
That's fun, because you've got physical therapists in there, oral facial surgeons, everyone that's kind of like.
We had 2 orthodontists that were airway focused orthodontists,
Right.
So,
and then the best thing is other dentists that don't know about what you do as a dentist. So it's like kind of bringing them along with you up to speed.
And that was my whole idea with Myoaligner. I was just trying to bring more awareness. We've seen so many good results, beautiful cases that we have changed their lives, that I wanted more and more dentists and to find out, that there's hope for these patients, and they cannot do it themselves alone. They have to reach out to other professionals, and they need to understand that this problem is multifaceted. Right. That's why they need a multidisciplinary approach.
Yeah, if they can't do it on their own, it's good to have you as a point to be able to refer to, and kind of knowing.
I'm hoping that more and more dentists will learn, because believe it or not, in an average dental practice, about 25% of patients complain of jaw pain and clicking and headaches. but the majority of them just leave the practice with a simple night guard that's made in 15 minutes
Right.
by a lab technician. You know, the lab technician is not correcting the orthopedics of your head and neck. And the night guard is basically a shock absorber. So you don't grind your own teeth, but you grind the night guard. Well,
Yeah.
as you said, the source of the problem is not addressed. The airway is not addressed. The upper cervical alignment is not addressed. And believe it or not, a night guard can actually make sleep apnea worse in some cases.
Sure.
It will allow the mandible to retract. And
Right.
so, you know, imagine if these patients, 25% patients in an average practice that has 2,000 patients, that's about 500 patients. They can impact their lives by putting them in the right appliance or referring them to the right practitioner. And then those patients all have family members and they have children, you know, that might be suffering from. So once you educate one provider, you can actually impact thousands of lives.
Right,
And
right.
that's my goal.
That makes you feel good about what you're doing.
Yes.
Yeah, that's great.
You mentioned Myoaligner a few times. I didn't know. I wanted to, for people that are not familiar with Myoaligner. So we keep going back to how a pathological occlusion can impact the alignment of the neck and the whole body. And, you know, a pathological occlusion is hard to fix. You know, sometimes if you have severely worn down teeth, you need a lot of restorations and crowns and veneers to rebuild the teeth back to
get the structure sound again.
Exactly. Yep. Or you might need orthodontics to move the teeth to the right alignment. So, which can get pretty expensive, you know, and costly. So what we decided to do was to kind of like break it down into phases. Phase one is to treat the whole body and also get the occlusion under control. So at Myoaligner, we developed these segmented orthotics.
Yeah, that's the part that was impressive. It's a modular. It's not just one different night guard. It's
exactly. You know, it's just that's
perfect Legos.
Section of the mandible, because when you use your head and neck, you know, the bones flex, cranial bones flex, mandible flex. So most orthotics are going across, you know, and they don't allow for flexion of the mandible during treatment and function. I just didn't want the patients to just wear it at night. I want them to wear it all the time so they're not beating up that joint or the neck bones. So we made this modular into 3 segments, and even if the patient's like missing a tooth, they can wear it. So the teeth don't need to be altered. It's very very conservative. You don't need to shave your teeth down. You don't need 20 veneers or crowns. So imagine if somebody has a poor occlusion, like in this patient, the dentist can make this and kind of like a shoe orthotic, you know, it can help your posture.
Like a heel lift,
Exactly, heel lift. Yeah. This is a heel lift. So if the patient's mandible is canted, for example, and because they lost a few teeth there, their Myoaligner orthotic is going to be a little bit taller on that side to compensate for that tilt. So that's going to keep your C1, C2 alignment all the time. Every time they swallow, they chew, the teeth touch, and muscles have memory. So this is more like a deprogram or reprogrammer to reprogram them into a new position. And when they chew and swallow 2,000 to 5,000 times a day, now their muscles are used to that posture. Now they're, and it can affect everything all the way down to the toes. You know, we're coming up with, I've heard people talk about tooth to toe or teeth to toes connection, and it is really connected. You know? Because even if you have like a pronation in your feet, you can see the effect in your exactly. And the way you close your mandible and the TMJs, eye alignment, everything. So to be, that's why again it's so important to bring different providers with different specialties to look at the body head to toe.
And have the providers understand where a patient might need to focus first. You know, and then to kind of get a good baseline or something like that. So they have, even if they're not doing it, you know, if someone comes into me and they just have horrible TMJ pain and their occlusion's off, I probably wouldn't start them with just trying to adjust them and see how it helps. I want them to be evaluated by you and have that camaraderie, that multiple minds thinking about where this patient's at right now. And that seems, I mean, it makes a patient better faster, is the thing, instead of kind of hunting around. I tried this, it didn't work. I tried that, it didn't work. The multiple disciplinary approach is, I remember you have or had someone to refer to for the actual therapies of how to swallow properly, you know, and
therapy.
yes, yeah. And now whenever I swallow, I'm always thinking about, okay, is my tongue coming up? And then I can, you know, I do have a question for you. It's kind of funny. I saw it on someone's post the other day that someone can't swallow more than 5 times in a row. Is that true?
Wow, I never heard that before.
Yeah. So we're talking about swallowing and how to properly do that, you know, and I'm wondering, and maybe that's true because a lot of people aren't doing it properly.
If you have a weak tongue muscle, yeah,
right.
that can get pretty tired.
Fatigued. Yeah.
The back of the tongue needs to lift correctly.
Right.
And so one test that I have my patients do is to see if they can suction their tongue like this.
Do the click. Right.
Like that. See how powerful that was? Most people, I bet you, if they try that in front of the mirror, they're going to do this. They can't. Yeah. Right. So it's really important for patients to see if they can lift the back of their tongue. And so with myofunctional therapy, we'll try, kind of like I always use the analogy of having core muscles. I'm like, if you don't have good core muscles, your back and your hips are going to be in a lot of pain. And same with the tongue. If you don't have a good tonicity in your tongue, the swallowing muscles will get lazy. The the pharyngeal muscles get lazy. Traps. Yes. Yeah. All of that, and and that can just gradually close the airway. And it's like domino effect again, because you're closing your airway and your brain doesn't really want you to die that night. It's grind your teeth forward, open up the airway. That's why most patterns that you see with grinders is that they have wear on their anterior teeth. Front and back. Yeah. And if you match those anterior teeth, they're just perfectly meshed, and you can see that that's where their wear pattern. So head posture and sleep really affects their the alignment of the whole body. Right.
So does someone, so like if I say my mom is I don't know if she is or not, I'm just saying, if someone needs to get in to see you, do they have to be referred to you?
Yes, a lot of dentists, a lot of ENTs, oral surgeons are referring to us,
Yeah, but I mean, if someone's watching this, on YouTube right now.
Oh, okay. I mean, if I'm in their area, I could be one of the possibility, but there is neuromuscular dentists. I wanted people to know how we are treating these people so they can find the right specialist in their own area. If somebody is in London now watching this, look for a neuromuscular or a physiologic dentist, look for an MJ dentist who also is aware of the connection between the airway and body alignment. If they've been doing this for a long time, they have a group of practitioners already kind of like connected and collaborating. So that's a good sign to know that they're doing the right thing. So they can also reach out to me through Myoaligner, send us a message. We're on social media and websites, and they can send us a message, and we'll try to find the right practitioners for them, because we know a lot of people, and
good. So, you'll help them out if they're not in the area. What I wanted to just kind of, I don't know if we're getting to about to close or not, but the types of issues people may come in with, even if it's not pain in their jaw, that it could be a problem with how they're biting. Like you mentioned before with kids, it's ADHD and cognitive problems. I know I've seen patients with the migraines, the headaches, brain fog, and having more than just tooth problems. That is their bite. That's part of it. That they had no idea. And that simple question is, when you bite down, are your teeth touch at the same time, or when you swallow, is your tongue going to the top, and start getting that people aware, like, oh, this is something to take more serious,
Yes.
and have solutions for. So.
And sleep quality. If they're in bed for
Yeah.
9 hours and they still wake up foggy and tired,
Right.
we have to have 3 coffees, in the morning to wake them up. That means they never fell into that stage 3 and 4 sleep, which was
Right.
healing, which, allowed their body to heal and rejuvenate. So, because if they fall into that stage, then they're going to choke themselves with their tongues.
Sure.
They're light sleepers. So,
Yeah.
Besides the things that you mentioned, sometimes snoring, not everybody snores, having to go to the bathroom a few times in the middle of the night, waking up with dry mouth. Those are, not being able to breathe through your nose very well. One of the tests that we do is a Colette test. When they close their mouth, you have them breathe through their nose, they pay attention to the airflow, and then just have them stretch this part and see if the flow of the air change. That means that they have a small palate, small maxilla, that is not allowing good nasal breathing. So
Right.
those are the patients that really benefit from a palatal expansion and mid expansion to establish good nasal breathing. So
Cool.
Those are all our forms. If people want to kind of get an idea, they can go to my website. Aesthetic Smiles is my office in Portland, Oregon. They can look up, go to aesmiles.com, and in our new patient form, you can see the type of questions we ask a patient. Very different than what you usually get at a dentist.
Right. That's
I
great.
welcome dentists to use it to reach out to us to learn about this, because you are so capable, and dentists are the only ones that are looking in the mouth every 6 months or so, because most
Right.
How often do you see your primary care physician? And last time you saw him, when was the last time the primary care physician looked in your mouth?
Right.
And screened for sleep? They don't do that. So it's dentists are they're so capable. They have the basic knowledge to look for signs and symptoms in the mouth.
Right.
Scalloping on the side of the tongue can also be a great, if you don't swallow correctly, swallowing is a reflex. You're pressing your tongue against your teeth. So you see scalloping on the side of the tongue, yes, which is an imprint of your teeth. And that again shows poor tongue posture and poor swallowing. So there's a lot of signs that we look for.
Cool. Good.
What a great conversation. I get so excited, when I talk about the subject, because I know how valuable it is for our patients' long-term health.
Yeah. So, no, I love your passion about it. That's why when I met you, I professionally, looking to see who could I put into a network that I could refer to, and your passion stuck out about how it's not just, this is a practice and your job. You have that passion to help people further than just, your DMD initials.
Thank you, Dr. Burks.
Yeah.
Feeling is mutual. Thank you for taking such good care of our patients. They're just so happy with you.
Good. Yeah. It meshes well, the care. And what you're saying, so I was thinking of a website. If someone needed to find upper cervical doctor in their area, I would just type in a search upper cervical and then the city where they want to find one. And usually that'll kind of bring up whoever, because there's multiple places you could go on a network to find, but the fastest way is just type in those words, upper cervical, and the name of the city. And look at their website. Are they kind of talking about upper cervical for the majority of what they do, or is it at the bottom of the list? If that's only the option, then that's good. But if you're wanting upper cervical care, you want an upper cervical clinic, upper cervical chiropractor for that very focused, specific care and those types of results. So. Yeah.
That's great. And if they want to find you, please share your website, please. Oh,
yeah. So uppercclinic.com. I have my brochure. Very high tech here. Uppercclinic.com. And And we're in Tigard, Oregon, in a very well. I mean, you can see my background is it's a nice office.
Yes.
But yeah, people have, we're in the second floor. We've got an elevator if you got ambulatory issues or whatever. But once you walk in, you'll know it's a different type of a chiropractic clinic, just from the flow of things, and it's a whole different take on, you know, alignment of your vertebra and why and where. But yeah, it's been good. It's been fun
the
practicing.
relaxation room with those cozy blankets
Oh, yeah.
and nice music. So
Yeah.
you want to relax? Definitely go to them.
Yeah, you just come for a nap, even if you don't want to care. It's good.
Yeah, I wish you were closer, so I would just come after.
Yeah.
Yeah.
Might not get you out of that room.
Yes. Well, is there anything else that you want to add to people that are listening?
Just dive into the information a little further. You know, if something intrigued you, search it out, take a little time. Or if you're thinking of someone that came to mind as they were listening to this, you know, share that video. This one, I have quite a few patients that have come in because someone posted something not about them specifically on their Facebook to share, and they said, "Hey, I heard about this on Facebook," you know, and they would have never showed up and got the results they have now if that didn't happen from that person. So
that's a great idea. Thanks for sharing that. Yes,
sharing is caring.
Yeah. Yes.